Is progesterone for men? Absolutely. Progesterone is what I would consider the predominant female hormone. Now, men, we have very small amounts of progesterone produced in comparison to females. Progesterone as a molecule, it is unbelievably anti-inflammatory, improves our mitochondrial function, which means more energy. It's anti-cancer. When we give men back those hormones, we see this amazing effect where all of a sudden the symptoms of PTSD diminish quite significantly. They notice that their quality of life improves. They notice the brain fog go. We know that these hormones, especially in men, have very, very, very positive effects. Hey guys, welcome back to the podcast. This is the Nico Misleh Podcast, brought to you by myself, Nico Misleh. And I've got a good one for you today. Is one that's been, I don't know, there's something in the zeitgeist right now, at least in my circle of medical providers and whatnot. Something struck a chord. And this question has been asked more and more often by many other providers, which I think is really interesting because it's a question that I asked about 10 years ago, frankly. And I didn't have a lot of information on it. And now I do. The question is progesterone for men? And it's a great question. It really is. I think it's a very good question because when I asked that about 10 years ago to some of my mentors, the vast majority of them said no. And what I know what they were trying to say is, do men produce progesterone first and foremost? Absolutely. Yeah. If you didn't know that, by the way, don't feel bad. Progesterone is what I would consider the predominant female hormone, not estrogen. So I want to break this down a little bit for you. Progesterone is a hormone that we see that I believe significantly separates men and women. Both of us produce estrogen or estradiol, men and women, right? Obviously, women produce copious amounts of more estradiol than we do as men, but nonetheless, we do produce as men a good amount of estrogen and estradiol. That's a really key feature of, I would say, humans and mammals and many other animals in general, is the production of estrogens. Whereas progesterone, if we compare it like apples to apples in the serum level in terms of numbers, men produce like infinitesimal numbers of progesterone in comparison to our female counterparts who produce copious amounts of progesterone throughout, especially their young adult life. When pregnant, the amounts like triple, quadruple. And then, of course, unfortunately, as time goes on, most women entering into perimenopause and menopause will eventually really lose the vast majority of all of the progesterone produced in their female bodies. Now, men, again, we have very small amounts of progesterone produced in comparison to females. And again, that's why I'm saying there is quite a big gap of separation there. Men classically, we don't get pregnant, and we don't have a uterus. And so there are things that inherently we don't utilize progesterone for like women do. However, that being said, progesterone is still something that we as men produce. And so when I asked the question, is progesterone actually vital and necessary for men, I can see where many of my mentors and many providers to this day would usually just say no, like blanket statement, no, not really. If you don't have a uterus and you're not making babies, literally in the oven, so to speak, right? You don't really need progesterone. However, the more I sat with that, the more I thought that doesn't make any sense. So why do we produce even just a little bit of it? Is it a garbage hormone, right? There was this idea that circulated for many, many years, for decades, again, that there were hormones or these metabolites of hormones that were junk. I think that idea, I'm postulating here and speculating, I think that idea came from the same idea that, of all the genes that we have in the human body, only a handful of them are truly like active and the rest of them are non-active and they're just kind of junk. They just kind of hang out there. And I think as we grow into the field of genetics, first of all, what we know is that genetics is not all it was cracked up to be in many ways. And it seems to be a lot of circumstances where genetics really don't play a huge factor in our health and wellness, which is interesting. But let alone there are these kind of junk bits of genes and DNA and whatnot that actually serve deeper purposes than we thought, and maybe could be turned on and off depending on the signal. And so in the world of hormones, for example, dihydrotestosterone was kind of thought as a not very vital or necessary hormone for many, many, many years. We knew it was a metabolite. We suspected that likely it had some involvement. As time grew, we understand, wow, DHT, dihydrotestosterone, has an incredible effect on androgenicity, or the maleness of a person. And what does that mean? Well, for a man, that could be the growth of male organs, right? So if you think about the penis or something like that, that is a very DHT-rich site. And as we develop from infancy into adulthood, we need copious amounts of DHT to measure and create that output. Similarly for females require DHT for their, counterpart organ, which would be the clitoris. I know, I can't believe I'm talking about this on air. This is crazy. My mom would kill me. Don't tell her. But when we're talking about the penis and clitoris, we're essentially talking about a comparable organ, right? They're kind of very similar in the shape and structure and things of that nature, but at the same time, they require very different amounts of these certain metabolites like DHT, but at the same point, we're still needing that hormone to produce a really good outcome, whether it's a lot or a little. You're following me? So allopregnanolone was another one. Again, a hormone we are growing to learn more and more and more about. It's a metabolite of progesterone. Again, classically speaking, a lot of people poo-pooed using oral progesterone capsules because it has this first pass effect, and all of your progesterone is just going to turn into this junk called allopregnanolone, and that's not what we want. And now all of a sudden it's like, actually, that's not a bug. That's a feature. We love a little bit more allopregnanolone. Because why? Well, for women with anxiety or crippling insomnia, allopregnanolone is amazing. It helps relax and cool the central nervous system off. And so, again, when we're thinking about junk hormones or junk genes, we now have to really figure that, okay, I don't think the way we grew and developed as human beings, I don't know if there's a lot of junk. It might not be obvious to us yet what it does, but likely there's some purpose to it. And progesterone is one of those things for men. Is it in the same quantity as females, or does it have the same effects? Well, certainly not, of course, right? We understand the difference between men and women. Where we need to give progesterone some room is that I believe just like women can become progesterone resistant. Okay. And for those of you who are shaking your head like, what the heck is he talking about? Progesterone resistance. I'm literally talking about progesterone resistance. Like if you know anything about insulin resistance, right? There's growing literature around hormone resistance across the board. That could be androgen resistance, right? You're a little bit more resistant to the effects of, say, testosterone or DHEA or DHT. Just like you might be, insulin resistant. You produce lots of insulin, but your cells, for whatever reason, just don't reciprocate, right? They don't have that reciprocity. So progesterone resistance is a growing thing. In fact, this is a huge part of what I'm going to be talking about in my advanced female HRT course, which is going to be freaking awesome, which is going to show and bring to light this idea that, hey, like in this day and age, like we're seeing likely more and more and more progesterone resistance. Now, we don't necessarily know or understand exactly why. We can kind of theorize around that, and I do in the course, and I'll belabor you from that because it's long and there's a lot there. But well, I think men can have the same thing too, right? If women can have insulin resistance, can't men? And if women can have progesterone resistance, couldn't men also? Now, is it going to have the same rate and effect across the sexes? Well, I don't know, but probably not. But does that mean we just like ignore it? Well, no, we should definitely not ignore it. And so one of the things that, outside of progesterone just being useless and not necessary for men, let's just say it might be. There was a study that was done, I don't know, probably 10, 20 years ago by now, where they were giving men progesterone. Ironically, the study was giving men progestin and progesterone. Okay, so two arms of the study, one arm getting progestin, the synthetic, nasty, non-identical version of progesterone. It's a non-hormone substance. I'd highly recommend, obviously, you never take that as a female or a male. But then they also did use bioidentical progesterone. When they gave some of the men bioidentical progesterone, they noted that some men had what appeared to be an inflammatory-like response. And so they measured some inflammation markers. I think it was CRP and maybe some interleukins and cytokines and things like that. And they saw a little bit of a spike. And so again, what this study determined was that if you give men progesterone, it's inflammatory, and we should never give men progesterone. Or at least that's what a lot of the proponents of progesterone is not for men started saying. Now, ironically, we all know this, but it bears repeating. Remember that just because something is associative doesn't mean it's a cause, right? Association does not equal causation, right? So just because I give someone progesterone and they have a little bit of inflammatory response, and by the way, this study was small. It was like 70 something odd men total. Just because something occurs at a small rate, now there's some signal there that's worth investigating. But if it were done more broadly, do we see that same result? And so again, the same proponents of saying, well, progesterone causes inflammation are also saying that estradiol does not cause any harm or issue with men. And in fact, the estradiol numbers can go as high as possible and it doesn't matter, right? Association doesn't equal causation. That's what they're saying. And I say, I agree. I totally agree with that in many ways. So why can't we have the same emphasis around progesterone in men? At least that's what I thought. So unfortunately, as you can imagine, giving progesterone to men, not a common thing to do in modern society, and certainly not something that has been heavily investigated in any way, shape, or form in modern science and academia. However, over the past 10 years and even the last 5 years, we've seen a little bit more progesterone and male stuff coming around. So a really big randomized control trial was done. And this was really fascinating. I'd be so interested to really dig down as to why these researchers did it, because I know why they did it. Because when you look at progesterone as a molecule, it is unbelievably anti-inflammatory for the most part. It does stimulate the immune system in interesting ways. So I'm not suggesting that it can't cause a blip or a short amount of inflammation in men. I'm not suggesting that. And by the way, we see that in women too, right? As estrogen levels fluctuate, we can see some changes in the immune system and whatnot. But inherently speaking, in general, blanket statement, progesterone is highly, highly, highly anti-inflammatory. I mean, it is literally a pro-mitochondrial benefactor. It directly and indirectly improves our mitochondrial function, which means more energy. So it has a bioenergetic pattern, which I know sounds really hokey, but it's true. It's really important for that. And that's across both sexes. I mean, and that's across other species too. I mean, like progesterone in mammals, that's just what it does. It's very, very, very anti-inflammatory. It's anti-cancer, a bioidentical progesterone. So just with that understanding, I understood that when these scientists did a randomized control trial, and it was with men, specifically men suffering from COVID in the ICU. So we're talking about, I don't care what your feelings are about COVID. Let's just talk about COVID as one of the most significant recent nasty illnesses over the past 100 years. And we know that COVID has very strong pushes on the immune system and significantly inflammatory, right? We see an increase in cytokines. We have the cytokine storm. That's kind of a classical thing that we see in COVID, especially. Now, we see that in flus and many other things too, but it just seems to be really heightened in COVID. We see it especially attacking, and attaching to ACE receptors in the lungs and things like that. So obviously respiratory issues, whatever. So we have these men and they're stuck in a hospital, and it's a big study. I want to say it was in the hundreds of men. We had one arm not getting progesterone, and we had another arm receiving progesterone in the ICU, men. And the men who received progesterone in the ICU with COVID had significantly better rates of walking out of that ICU and at a much faster rate. So literally like a couple weeks in terms of like how quickly were they healing. And what we saw was that progesterone had a significant effect on inflammation at large in these men. So interesting, right? Because again, that older study, not that old, but slightly older study, small studies showed that if I gave a little bit of progesterone to men, we see some inflammation spike up. But again, association does not equal causation. Now all of a sudden we flip that script and we go to several hundred patients receiving the same medicine, bioidentical progesterone, in an ICU with one of the most nasty inflammatory diseases out there. And all of a sudden these guys are walking away, earlier and better just by receiving progesterone. So can I say definitively, based on the literature, not my opinion, based on the literature, that progesterone is anti-inflammatory in men? Yes, I can. I have no harm in saying or qualms about saying that at all. It's not my idea. This is just what we've seen in the literature. I will say that, yes, there was a study done a long time ago that showed that was not true, or at least that's what they assumed. But again, that was just an associative thing. What we now see in a randomized control trial, a large randomized control trial, giving progesterone to men with COVID, one of the most inflammatory diseases out there, lowers inflammation and gets people out of the hospital, out of the ICU earlier. Amazing. Incredible. What other things are we seeing with progesterone? I just talked about this in a recent email. When we look at men, specifically men, with good, healthy, quote unquote, baseline levels of progesterone, which by the way is there's not a very clear understanding of what that is. But let's just assume it's based on the regular reference interval, which I don't remember those numbers exactly. They're very, very small. Men who had quote unquote normal, based on conventional lab settings and standards for reference ranges, men who had normal baseline progesterone levels, who were experiencing suicidal ideation and were combat veterans. Okay, so we're talking about men who served in the military in the United States. They are now veterans dealing with, likely, I'm sure, PTSD and depression and many other things. They are saying that they deal with suicidal ideation if their progesterone levels are, let's just say, normal, or even we could say optimal. Those men do not attempt suicide at even close to the same rates as their counterparts who have, quote unquote, low levels of progesterone. Men who are combat veterans suffering from suicidal ideation, if they have low levels of progesterone, they are more likely, they're at a greater increased risk of actually attempting suicide. Fascinating, right? Because again, this is a signal. And again, by the way, this study is small and it's a signal. Just like we had the signal from the first study, which was like, I think progesterone might cause inflammation in men. Fair enough. That was an interesting signal. If we extrapolate that and we broaden that out and we have a better randomized control trial, do we still see that? No. Okay, cool. So we're going to say that's not true. Now what we're seeing is a new study that is potentially suggesting that progesterone has an anti-suicide effect. It is somewhat preventative. And we understand that, of course, the neurohormonal, biological nature of the brain and the emotions and the mind and things like that, there's very, very interesting connections there. And we're sorting through those things. But what we definitely know in combat veterans across the board is that optimal hormone levels in general are very, very, very helpful, right? We've seen infamously Dr. Mark Gordon, who's a legend on that front, talk about traumatic brain injuries, men with traumatic brain injuries, especially veterans. That's a very common thing to find in that population of men. If men have experienced traumatic brain injury, they are more likely to also have PTSD. And so the question then becomes, is there an association between traumatic brain injury and PTSD in men? And yes, there does appear to be an association, which is fascinating. And what we've also discovered, at least through the efforts of Dr. Mark Gordon and many other providers like myself and others who have explored this, is that if we provide those men who have a lot of inflammation in the brain, maybe some, God forbid, who knows, some type of secondary or tertiary type of hypogonadism, right, where they're not producing enough gonadotropin releasing hormone in the brain, or luteinizing hormone, or follicular stimulating hormone. If they cannot produce those hormones, then really the downstream effect is they don't produce any hormones from their sex organs, right? If we don't have enough of these brain hormones, there's no way we're going to get enough progesterone, estrogen, testosterone, DHT, you name it. And so when we give men back those hormones, testosterone, DHEA, and all these sorts of things, we see this amazing effect where all of a sudden the PTSD, the symptoms of PTSD diminish quite significantly. They notice that their quality of life improves. They notice the brain fog go away. All these really interesting things all of a sudden start to develop. And so, okay, we know that exists from an androgen, especially an androgen perspective, right? So I'm talking about testosterone and DHEA and things of that nature, even DHT. We know that these hormones, especially in men, have very, very, very positive effects on mental health. And we know that for women too, by the way, but just to emphasize on men for a second here. So are there not other hormones, practically all of the hormones, of course, don't they all have some effect on the central nervous system and the brain and the way we behave and regulate our moods and whatnot? Absolutely. So where does progesterone fit in there? Well, remember, progesterone as a hormone is inhibitory in many ways. And again, I think when we hear the word inhibitory, it sounds kind of bad, but it's not a bad thing. Like we have the gas and the brake pedal, right? The gas, so to speak, I believe in human beings, in terms of hormones, tends to be more on the androgen and estrogen side of things, right? They're a little bit more excitatory in many ways. They drive libido, they drive motivation and ambition and all these amazing things that we know and love about human beings. They tend to have just a little bit more of a sympathetic nervous system type of drive. Now, I'll give credit where credit's due. Testosterone does also enhance some parasympathetic stuff too. But nonetheless, progesterone, things like pregnenolone, allopregnanolone, these three hormones, they all kind of stem from what's called the pregnane family. So if you can think of the, tree of hormones, from cholesterol is our kind of base molecule, and we'll take that cholesterol and we'll use enzymes in the body to break that cholesterol down and metabolize it into our sex hormones. And they all start with pregnenolone, and from pregnenolone we get all the other hormones, right? So pregnenolone is really the mother hormone. But pregnenolone to progesterone to allopregnanolone, those three hormones in particular share a lot of similarities in the sense that they all drive down inflammation pretty significantly. They all seem to have inhibitory types of responses in terms of, say, regulating things like estradiol, which is very proliferative and excitatory. So if we think of estradiol, again, as a hormone at large, and estrogen as an umbrella, they drive proliferation, growth. That is the goal of estrogen, right? And we've talked about this with PMDD. Outside of driving cellular growth, grow, we also see on the sense of the nervous system and moods and emotions, it's excitatory. So in the brain, estrogen and estradiol in particular stimulate glucocorticoid receptors, which can stimulate cortisol and norepinephrine and adrenaline and things of that nature, which is, again, not a bad thing. It helps us have a lot of motivation and drive and oomph. Maybe a little bit, just a teensy weensy bit of anxiety, which is, again, not necessarily a bad thing when we're trying to get stuff done. But if we see a lot of that, we can also see a lot of excitatory kind of neurochemicals or neurotransmitters. So glutamate is one. If we have a little bit too much excessive glutamate activity in the brain, it causes a lot of stress, and it can lead to significant amounts of anxiety, more inflammation. It kind of starts that pathway. And again, that's where we see a lot of generalized anxiety disorder, PMDD. We see them kind of fall in this similar pattern. Obsessive compulsive disorder, I think in many ways, we see a lot of that heavy excessive glutamate activity likely stemming from a lot of the estrogenic effects. So progesterone does the exact opposite. Progesterone is inhibitory in that sense. If glutamate is kind of the brakes in the brain, if glutamate is the gas pedal in the brain, what is the brakes? GABA. If you guys remember what GABA, right? So GABA and glutamate, remember those two things. Glutamate is the gas, GABA is the brakes, and our central nervous system at large. Progesterone, specifically because of its metabolization, its breakdown into a hormone called allopregnanolone, this is where we derive a lot of the inhibitory nature in terms of mood and behavior. It tells the central nervous system to relax. Allopregnanolone specifically reacts with the GABA receptors all across the central nervous system, and in particular the brain, of course. And this is where we see a lot of the anxiolytic effects, anti-anxiety effects. This is where we see a lot of the calm and relax. This is where we see a lot of the no more insomnia stuff, right? So if we take that, again, just a broad brush, but if we take that understanding the principles of hormones and we now apply that, we can see that happening in women. We know that PMDD, premenstrual dysphoric disorder, generally speaking, is just a disorder of low progesterone and too much estrogen or xenoestrogens pushing on that poor woman's brain, especially at that time within her cycle where her progesterone is not high enough to meet her needs. And she suffers from what? Typically extraordinary amounts of irritability, anxiety, sometimes even homicidal ideation, God forbid, because their brain is on fire. So when we add what is now an FDA-approved medication called brexanolone, which, by the way, is just FDA's way of taking something as powerful as allopregnanolone and just kind of patenting it. Yeah, crazy, right? We see a significant reduction in premenstrual dysphoric disorder, postpartum depression, like as if they vanish. Most of these medications are typically done via an IV infusion. They're extremely expensive, like thousands and thousands, tens of thousands of dollars. And ironically, all what the FDA has kind of figured out and what these big pharma companies have figured out is, oh my gosh, all we need is allopregnanolone. We've got it. The body makes it. We just need to enhance that. But we don't have to pay tens of thousands of dollars. We can pay pennies on the dollar for just good old-fashioned progesterone. And if you take it orally, like I talked about, I'm harkening back to early in the podcast, if you take progesterone orally and it goes through what is called the first pass effect, right? It goes into your GI system and then into the liver essentially and gets metabolized very quickly. Much of the progesterone that you'll take will also turn into allopregnanolone. And all of a sudden, women feel nice and sleepy and relaxed, and they wake up in a great mood and all their anxieties are gone away and all that amazing stuff. And it's simply because we are enhancing we're taking that beautiful progesterone molecule and kind of almost amplifying it so that we can get the best of both worlds. So again, I'm speaking about a lot of lady stuff here, but it's only because I want to help you recognize that, okay, if we can get those effects similarly in women, could we not also see that in some way, shape, or form over on the male side of things? And again, I'm not saying we're not the same type of being, right? Men to women, very different, complex natures, very different in terms of hormonal profiles and all that stuff. But nonetheless, we all do produce the same hormones in different ways and in different rates. Do we not see even just some of those principles exist across the spectrum? We certainly do. And in terms of progesterone, what do we see? Well, in that study I just mentioned, men who apparently have much healthier or normal or whatever levels of progesterone at baseline, now they might experience suicidal ideation, which is a travesty and something we're going to try to fix. But fortunately, they do not seem to attempt suicide, not nearly at the rate in which men who have low progesterone levels do. And why is that? Well, could it potentially be that it is because progesterone and its metabolite allopregnanolone significantly reduce that excitatory type of stuff going on in the brain, helps men relax and helps decrease their overall stress levels? Okay, so here's another thing that progesterone does amazingly well. Progesterone, in many ways, will also lower the male and female stress levels significantly. And how does it do that? Like, what are the ways in which progesterone would do that? Well, it helps to regulate cortisol. And in many ways, it helps regulate estrogen. And estrogen and cortisol have a very unique relationship. Estrogen and cortisol, they're like kind of peas in a pod. If you tend to have higher cortisol levels, you'll typically tend to have higher estrogen levels. And that estrogen will then literally feed on these glucocorticoid receptors all throughout our body and say more and more and more, producing more and more cortisol. And now it just becomes this kind of vicious cycle. Well, we understand that progesterone has very anti-stress effects. And by the way, stress is not a bad thing. Stress is a good thing, just in, certain quantities, right? We don't want chronic stress. We want acute stress that our body and brain and heart and soul deal with and our hormones can handle. And then that quickly goes away. And that makes us hopefully stronger and more resilient in the future. Well, progesterone is one of the most critical components of our human body's ability to regulate stress in a lot of ways. And most of the way it's doing that is just by, again, directly and indirectly helping control our mitochondrial output. This is a big HRT principle. And again, I'll repeat it over and over again, but there's this idea that, and I don't know if some of you guys are like really deep into the health influencer spheres and all that stuff, but you've probably all heard the importance of metabolism, right? The importance of what is essentially energy production and mitochondria and how important and fascinating they are to the human body. And we have millions and millions and millions of them throughout our body. They're literally they're still the powerhouse in many ways of the human body, producing copious amounts of energy for us to utilize, amongst other things. But if you can recognize this, energy is the currency of life, right? It's the green dollar bucks that make life amazing. There's rarely a time where more energy is a bad thing. Right? When we have healthy amounts of energy being produced, we can then function appropriately. The structure and integrity of the organism that has healthy amounts of energy runs well. Okay. If you think about that as a car, a really obvious example, if a car has enough gasoline, it can go for miles and miles and miles. If it has a clean, healthy engine, that's even better. If you get regular oil changes, all these things that we do to maintain the car's integrity and structure is important. But really, at the end of the day, if you're just trying to drive that car from point A to point B, you just need energy. And the only way we're going to get that is if we have enough fuel to produce that energy. And making sure that whole operational system is clean and efficient and effective. Let's take another example. Let's think about like a suspension bridge. Okay, if you've ever crossed like the Golden Gate Bridge or something like that, for example, those beautiful old bridges that literally are suspended looking in midair. That suspension bridge is being held together in many ways by, of course, concrete and iron and steel and all sorts of things. But there's a lot of stored energy in that structure. And I know you guys are probably like, what the hell is this Nico guy talking about? I promise you, stick with me. There's so much stored energy there. And that energy is really vital. It's vital to help maintain the structure and the integrity of that suspension bridge. So as cars travel across it back and forth, and right, there's some swaying and stuff from wind and all that. Of course, the bridge is going to take a little bit of a beating and some stress, and there's some upkeep there, but it is really that energy that's and the molecules literally helping to make sure that the concrete stays as one piece and the iron stays as one piece and the stored energy in the whole suspension bridge is maintained. Well, we think of that as our human body, and at even the cellular level, we rely, the structure of our cells literally are dependent on the energy that we produce. This is why as we get older, it's really a disease of energy loss. We just cannot keep up. We can't produce enough energy to maintain the cellular health. And so from the micro level, from the cell to the macro level of the organism, the entire human, we see that loss of energy. And we ultimately will see the death and degradation of that organism. So when it comes to progesterone and many hormones, they are literally vital parts, important pieces of that whole energy production system. And so, yes, are they inhibitory in the sense of like, yeah, they help calm the central nervous system and stuff? Absolutely. But they're not inhibitory in the sense of energy production. In fact, they're very proactive there. They are significantly pro what we would call metabolic. They help us produce energy. And this is again why we see men and women given many different types of hormones, be it testosterone or estradiol or progesterone. All of our sex hormones really help us drive more energy production. This is why we live longer and healthier lives. This is such an important component of hormone replacement therapy, because again, we can talk about all the amazing things that hormones do, and they prevent, cardiovascular disease, and they, help our bones stay strong and all that stuff. But if you really want to know why, like, why does it do that? Or how does it do that? Like, I want to know that. And it ultimately comes back to the energy production and the maintenance of that energy production via these hormones. I just think that's so incredible. So when I think about progesterone, and is it a viable option for men? 100%. Absolutely. Does every single male patient need to take progesterone like practically every single female patient? No. Okay. So I always make this quote relevant because I think it's true to this day. Progesterone is to women what testosterone is to men. So if a guy comes in with anxiety, even insomnia, and I look at his blood work and it's very clear that his testosterone is suboptimal, and maybe he's complaining of some other symptoms there, I'm always going to opt to treat men with anxiety alone first with something like testosterone replacement therapy than I would progesterone. That is not true when it comes to women for the most part. When women come in and they're complaining of anxiety and so on and so forth, I'm much more apt to turn to progesterone because, again, that is something that they produce in copious amounts. They produce a lot of testosterone too, but in general and on average is really a low progesterone problem for women, whereas anxiety and whatnot in men is oftentimes actually a low testosterone problem. And one of the reasons that is also is because men, unlike women, produce a ton of another hormone called dihydrotestosterone in comparison to women. That is what literally also makes us more manly. So progesterone is what really, and estrogen, but especially progesterone is what really, I think, characterizes females, whereas dihydrotestosterone is what characterizes men. Dihydrotestosterone is what puts hair on our chest. It's what, it lengthens our penis, for example. There are all these things that are just very specific to men, like beard growth and all those sorts of things. Significant amounts of armpit hair and all the nasty things that women don't have to maybe deal with, but it's what makes men men. And behaviorally speaking, we see the same thing too. Dihydrotestosterone, in fact, is quite comparable in many ways to progesterone and allopregnanolone. In men, we see that dihydrotestosterone is what actually helps us stay calm and relaxed and focused. It actually also has a bit of a parasympathetic effect on the nervous system, which is really, really amazing. So again, we see these really interesting comparisons and what it was, compare and contrast, right? We see a lot of comparisons and we see a lot of contrastions between certain hormones in the human body, male to female. So again, I'm more apt to treat men with anxiety, specifically with testosterone first. If it doesn't seem to resolve with the testosterone, they're still complaining of sleep issues. Maybe they just feel really tense. And I know, again, this is not something that's super easy to measure necessarily, but those guys, they sit in your office chair and their shoulders are up and they just feel really tight and nervous and anxious. Excuse me. I would at that point absolutely consider something like progesterone. I know, again, some providers might say, oh, you should try pregnenolone and whatnot. And by the way, pregnenolone is amazing too for that stuff. But we just don't have as much literature around pregnenolone in that regard. And again, pregnenolone is interesting as well because a lot of people would assume pregnenolone like metabolizes rapidly down into allopregnanolone, and we don't necessarily see that. It actually tends to stay just pregnenolone. I love progesterone because, again, we see very interesting and very quick responses to it when it comes to dosing. And dosing for men doesn't have to be extraordinary. And by the way, I go over that in my master course, all the dosing and whatnot. But we can use it for things like even BPH, benign prostatic hyperplasia. Right? If you think about the tenseness and the musculature around the pelvis and whatnot, and within that kind of genitourinary area, progesterone has an amazing effect at helping that relax. Progesterone also appears, and it's a little bit back and forth in a lot of studies. So again, take it with a grain of salt, but it has been shown in some studies to have anti-cancer effects, specifically at the prostate, which I think is super fascinating. So, but again, that makes sense. If we understand what progesterone is, it's an inhibitory hormone in many ways. It stops and tells the body no growth, no hormone, no estrogen, no more growth, no more, hopefully, cancer, God forbid. So that makes sense. And again, when it comes to the mood and behavior and whatnot for men, what I typically notice is that most of my, especially elderly male patients, so I'd say, at least 50, 60 plus is kind of the men that I'm typically finding myself providing progesterone to more often than not. Because those men are really going to start being depleted there. Again, another thing I consider a lot of times when I'm giving men testosterone replacement therapy, we are going to see a reduction in the gonadotropins, luteinizing hormone and follicle stimulating hormone. Again, these hormones are coming from the brain and the pituitary. Those hormones specifically go down to the testicles, and they're supposed to stimulate the testicles to produce testosterone, but also many other hormones, including progesterone and dihydrotestosterone and estradiol intratesticularly. There is a sense that if we stop completely the production, the intratesticular production of hormones, that it could have a net negative effect on men. What we see, again, in the randomized control trials is that we do not tend to see that happen whatsoever. Anecdotally, what I will tell you is that some men, it appears when they lose that intratesticular production of hormones, they might notice that they have some interesting sexual function issues going on. They might notice mentally they don't feel as good. And I'm speculating again, but it appears that potentially they may have some weak adrenal glands, which again is where the vast majority of our DHEA and even progesterone and things like that are also made in men. But maybe they just don't pick up the slack well enough there, or maybe there's something going on there intratesticularly that we just don't really have a good grasp on. We know that luteinizing hormone appears to be really, really, really important in many ways at reducing things like Alzheimer's and dementia. It appears to have radically interesting effects in terms of, say, Parkinson's disease. And by the way, I go over all this in my master course, so I won't belabor the point again too much here, but this is where I just find that there's these really interesting intersections with all these hormones, and they all matter. They really do in many different ways. And just because it doesn't matter for the vast majority of men doesn't mean that it doesn't matter for some. And so what I notice is that, say, for example, if I give men HCG or human chorionic gonadotropin to help restore intratesticular function, and maybe I just do it for fertility's sake, but a lot of these men will say, Nico, I feel better. My sexual function is better. My sensitivity is better. I notice my mood is better. And I'm saying, okay, well, there's a lot of reason probably to that. Number one, we know that, of course, we're going to restore some intratesticular production, and that also means that we're going to restore some aromatization intratesticularly and otherwise. We're going to see production of progesterone and hormones like that come back in play. So again, I'm just considering that, okay, maybe there's something going on there. Dr. Brett Weinstein, who I love, he's a really amazing biologist, and I just think one of those really great thinkers of our time. He described the human being as what does he describe it as? So human beings are a complicated system, not a complex system. And I think this is brilliant. So a complex system is a computer. Right? Most of us, like you and I, we have no idea what goes on in these computers that we're staring at all day long. We might understand that there's like ones and zeros getting passed back and forth, and there's a CPU and RAM and memory and all these different things. But at the end of the day, like, we couldn't probably build a computer on our own. And even if we did, we just wouldn't really understand the workings of it. However, that doesn't mean we couldn't figure it out. And in fact, once you do figure it out, it's unlike anything else, right? It's like building a car or something like that. It's complex. There's a lot of parts and pieces there, but it's not complicated in the sense that the ones and zeros are always ones and zeros, right? That never changes. You always need a CPU, like a processor. You have to have something that does that. And that processor always functions in this specific way. It could be more powerful or less powerful, but again, it's not complicated. Complicated is the human being. In many ways, we're both complex and complicated. Complicated is if I give a person X, Y, or Z type of medicine or hormone, we always 99.9999% of the time get this result. And do you know of anybody that responds that way? Of course not. Like, absolutely not. That doesn't make any sense. Like there is no way that would ever happen. So when we're thinking about human beings and hormones and all that stuff, remember, we are a complicated system. 1 + 1 does not always equal 2. And so when it comes to hormone replacement therapy, and when it comes to something like progesterone in men, just be a little more humble and recognize that, hey, things change a lot here. We're going off the best evidence and data that we can. And we're also not afraid to think outside the box a little bit and maybe have some ideas around what could work and what couldn't work. And we're okay exploring some of those things, of course, safely and whatnot. But again, I hope you found this valuable. At the end of the day, is progesterone safe and awesome and amazing for some men? Absolutely. I think there's no question. I think the evidence is clear that is true. And I think we'll see more and more evidence along those lines coming out. Again, in the master course, in the adjunct hormones, that's the only place you can get this adjunct hormone stuff. I talk about progesterone in men, and I try to give all the data that I know there. It's not much because there isn't a whole lot there, but I try to show you exactly how I use it and how I successfully treat men with it and what kind of outcomes you could get. So I hope that's helpful. Again, guys, if you're new to the podcast, welcome. Please remember to visit. We have all kinds of things. We've got Nico's daily email. That's my email that I write Monday through Friday. Just me, no chat GPT, and no BS ever. It's just good old-fashioned value and lots of education I want to give back to you guys. It's a great place to learn. All the things I'm talking about here, a lot of times I talk about in the email. So it's in the show notes. Click below to opt in. Totally free. There's a Facebook group called Nico's HRT University. If you search that in Facebook, it's a great group to also join and kind of get accustomed to the things that we do at HRT University and what other people are doing out there and connecting with other providers. And then, of course, don't forget, we have our lovely website, hrtuniversity.com, where you can check out all the things that we've got going on. And amazing. Thank you guys so much. Have a great day, and we'll talk soon.